Steady step is a system for analyzing gait function. The steadies allows you to study the parameters of walking to assess the functional state of the patient's musculoskeletal system or analyze the effectiveness of the conducted rehabilitation. To perform a gait biomechanics study, first of all, we install EMG electrodes on selected muscles. At the level of the calf, these are the gastrocnemius lateralis, tibialis anterior, quadriceps femoris, and the biceps femoris muscle at the level of the thigh. After that, using elastic bands, we attach sensors holders to the calves, the hips, and sacral area. We place the sensors in the holders and connect the EMG electrodes to them. Both movement parameters and EMG are recorded by a single compact device, Neurosense, the inertial miniature sensors that register speeds of rotations and acceleration along 3 axes, as well as an electromyogram along 2 channels. In total, up to 25 gait parameters can be registered. The sensors are wireless, powered by a battery, and transmit data to the program via Wi-Fi. First, a calibration is performed. The patient must stand straight. The calibration process takes several seconds, after which we press the Start Research button and give the subject the command to walk. When the subject starts walking, the neural network automatically determines the gait cycle and all other parameters in real-time mode. The operator can see how the data accumulates. There is a counter of gait cycles. Above are the temporal and spatial parameters of walking. Then come kinematic parameters, starting with hip joint goniograms in 3 planes: flexion extension, rotation, and abduction adduction, followed by similar goniograms for knee joints and then for ankle joints, also in 3 planes. After the kinematics of joint movements, profiles of bioelectric muscle activity in the gait cycle follow. First, the data for the anterior tibial muscle is given, then for the remaining studied muscles. The registration stops when the necessary number of gait cycles has been reached.